Mr Speaker, I present a bill for an Act to amend the Acts Interpretation Act 1954, the Corrective Services Act 2006, the Corrective Services and Other Legislation Amendment Act 2020, the COVID-19 Emergency Response Act 2020, the Disaster Management Act 2003, the Justice and Other Legislation COVID-19 Emergency Response Amendment Act 2020, the Mental Health Act 2016, the Public Health Act 2005, the Public Health and Other Legislation Extension of Expiring Provisions Amendment Act 2021, and the Public Health and Other Legislation Public Health Emergency Amendment Act 2020 for particular purposes. I table the bill, the explanatory notes and a statement of compatibility with human rights. I nominate the Community Support and Services Committee to consider the bill. Deputy Speaker, in presenting a bill for an Act to extend provisions requiring to support the public health response until the COVID-19 public health legislation expiry date, defined as the day on which the COVID-19 emergency is ended by the Minister under the Public Health Act 2005, and 31 October 2022, whichever is earlier. I'm pleased to present this bill. I think we all hoped that at this point in 2022 that COVID would be over, but the reality is, as we can see globally and nationally and here in Queensland, it certainly is not over yet. The measures to be extended in this bill include the public health COVID-19 measures under the Public Health Act, measures to respond to the risks of COVID-19 in corrective services facilities under the Corrective Services Act 2006, disaster arrangements under the Disaster Management Act 2003, measures to allow patients subject to the Mental Health Act 2016 to be granted leave to comply with public health directions, and a range of other measures. Deputy Speaker, the COVID-19 pandemic has been complex and unpredictable, presenting significant challenges across the globe for the past 2 years. Since COVID-19 was first detected, there have been over 400 million COVID-19 cases and nearly 6 million deaths reported globally. Since the start of the pandemic, Queenslanders put their trust in our Premier and Chief Health Officer to keep us safe from COVID-19. Due to the early and decisive action by the Palaszczuk government, Queensland's swift and adaptive public health response was highly successful in containing community transmission, providing the opportunity to reach high vaccination coverage across Queensland and ultimately saving lives. Since late 2021, Queensland has been easing restrictions and moving away from an elimination approach to a suppression strategy and toward eventually living with COVID-19. Under Queensland's COVID-19 vaccine plan to unite families, over 90% of Queenslanders are now fully vaccinated. We have reopened Queensland's domestic and international borders with no quarantine requirements for vaccinated persons. Also, contact tracing requirements have reduced and businesses are once again operating at full capacity. While the easing of restrictions has been welcomed by many, the recent Omicron wave has shown we must remain vigilant, as COVID-19 can spread rapidly and unpredictably, with the potential of significantly impacting hospital systems, the economy and the community. Our response to the Omicron wave is a testament to the careful planning and decisive action taken by our Chief Health Officer, clinicians, emergency officers, public health specialists, environmental health specialists and the broader health system. If not for the ability to issue directions, the Chief Health Officer would not have had the power to implement strategies like requiring masks in high-risk settings and requiring unvaccinated travellers entering Queensland to quarantine. These strategies have helped to slow the transmission of COVID-19 and the Omicron variant, limiting the impact on Queensland's health system through this peak period of transmission. The pandemic continues to be unpredictable. We don't yet know whether new variants may emerge, particularly now international borders are open. We don't know yet what the impacts will be in the winter months, particularly if it coincides with the flu season. Queensland Health is also anticipating several more waves of COVID-19 in coming months, with the potential for waves consisting of multiple variants. It is critical that the ability to use flexible and rapid public health responses is retained so that as normal social and economic activity resume, appropriate public health measures can be put in place if needed to address ongoing public health risks, the latest health advice and protect the health system. For these reasons, the bill extends essential measures to support Queensland's public health response to the COVID-19 pandemic beyond their current expiry date of 30 April 2022. The bill will extend most temporary public health measures by 6 months to 31 October 2022, or until I, in my role as Minister for Health and Ambulance Services, declare the end of the public health emergency under the Public Health Act 2005, if this is earlier than 31 October 2022. The bill will continue the amendments to the Public Health Act, giving emergency powers to the Chief Health Officer and emergency officers to make directions to limit and respond to the spread of COVID-19 in Queensland. These amendments allow for the Chief Health Officer to give public health directions that ensure masks are worn in places where you can't physically distance, people isolate when they contract COVID-19, and that our vulnerable populations in hospitals, aged care and disability accommodation are best protected. These powers have been critical to the success of the Palaszczuk government's health response so far. In addition, the bill will continue amendments to health and other portfolio legislation to support Queensland's essential public health response to COVID-19, including continuing measures to respond to the risks of COVID-19 in corrective services facilities under the Corrective Services Act 2006, disaster arrangements under the Disaster Management Act 2003, and measures to allow patients subject to the Mental Health Act 2016 to be granted leave to comply with public health directions. If and when I am satisfied that temporary COVID-19 legislative powers are no longer necessary to prevent or minimise serious adverse effects on human health, I am required to end the declared public health emergency under the Public Health Act. Should this occur, all temporary COVID-19 measures will cease, except transitional arrangements. The Palaszczuk government is committed to ensuring only those measures that are necessary to support Queensland's public health response to the COVID-19 emergency are extended. In closing, Deputy Speaker, I'm proud of the role the Palaszczuk government has played in responding to the most recent wave of Omicron, particularly as borders reopened. We'll be able to handle any challenge COVID-19 presents us in the future, so long as we continue to have sufficient legislative powers to do so. Together, we are learning to live with the risks of COVID-19 in a safe and adaptive way. I want to acknowledge Dr John Gerard, who took the reins of Chief Health Officer in December 2021 so seamlessly and continues to lead Queensland through the challenges of the recent Omicron wave. I also want to acknowledge our frontline staff, our health workers, our paramedics, our police, our border workers, and all of those working in retail and other service delivery who have worked so hard to make Queensland's response to COVID-19 the success that it has been. We know that their jobs have been difficult. I also want to thank the Queensland community for doing their part by physical distancing, wearing masks, getting vaccinated, staying home when unwell, and all of the other practices we do to minimise the risk of transmission. The pandemic is not over yet. We must remain vigilant and respond quickly to risks as they emerge. We must have confidence that our community will remain safe and that there are sufficient resources and capacity to manage all arrangements that are in place. The extension of the public health measures required to support Queensland's response to the COVID-19 pandemic will help us do just that. I commend the bill to the House. Deputy Speaker, I move that the bill be now read a first time.